friends, welcome back to the question answer series. I am Dr. Asha Baxi from Indore. Our today's question is to Dr. Kuldeep Jain. Dr. Kuldeep Jain is the infertility specialist from Delhi. He has been founder secretary and the past president of IFS and has done lots of national and international conferences. He has been chairperson of Endometriosis committee of FOXI. In that also he has contributed a lot. Dr. Kuldeep, as an infertility expert, what are your concerns during the endometriosis surgery and how would you address these concerns during the surgery?
Thank you, Dr. Asha. Whenever we do the endometriosis surgery in infertile patient, we are always concerned about the ovarian reserve. As we know that endometriosis affects the ovarian reserve, and surgery in these patients will again lead to the damage to the normal ovarian tissue. So it is always advisable to counsel these patients. We get the AFC as well as AMH done in these patients and then counsel these patients accordingly about the risk to ovarian reserve. That is very important, and that is the recommendation of X-ray also before proceeding for endometriosis surgery. Another concern is of recurrence. Endometriosis is always a recurrent disease, and it depends on the severity and the expertise of the surgeon. So, to minimize the recurrence, we need to take care of the complete surgery. Another concern that is always in mind, especially in severe grade of the disease where the bladder and bowel may be adherent and may be involved. So we need to minimize the complication to the vital organs. As far as the strategies to minimize the ovarian damage and recurrence rate, what we do in our practice is we do a lot of hydrodissection. Hydrodissection always helps in finding the plane. Right cleavage will give you less ovarian damage. We use very minimal cautery, and that is one important thing. If you are doing a lot of cautery, then ovarian damage is bound to occur. In large endometrioma, usually the hemorrhage is there and cautery is done exclusively to reduce the damage, and that leads to the further damage to the ovary. So it is always advisable if a cyst is large and there is difficult hemostasis, a lot of hemorrhage, then one can go for a combined approach, that is partial cystectomy along with fulguration. That also minimizes the risk of ovarian damage. Stripping in correct plane is very, very important. If you are stripping in wrong plane, then the damage will be more. So try to find out a clear-cut plane and then start stripping. For avoiding the complication, we can use the tissue sparing method, where near the vital organ we can leave a portion of the cyst, and that is how we can minimize the complication to the vital organs. Recurrence rate can be minimized again by selecting the patient and doing the complete surgery with expert hand. So these are some of the methods by which we can reduce the complication, damage to the ovary and recurrence rate. Thank you very much for your platform, and this is a very nice platform. Thank you again, and I wish you success in your election. Thank you. I also seek your support in getting me elected for Vice President of FOXI. Thank you.